Hi, my name is Dr. Splichal, Functional Podiatrist and Human Movement Specialist. I want to speak to you about bunions, or hallux valgus. Now, bunions is probably one of the most commonly misunderstood foot conditions, where people think that they're genetic or maybe you're born with them. They don't understand the cause. It's associated with shoes. You can treat them conservatively. And then other people say you have to have surgery. So I want to go in and start with, first, what is a bunion? A bunion is a deviation of a long bone in your foot called the first metatarsal. Now, this first metatarsal bone swings out, creating the classic bunion bump because the joint at where that bone sits has been associated with instability or ligament laxity. Now, the other side of the bunion shape is that the toe is being pulled outward. Now, the pulling of that toe is because there's small muscles called an adductor hallucis that pulls the toe over while the metatarsal is swinging out. So the bump that you associate with a bunion is actually your first metatarsal head. It is your bone. One of the myths that I often see is that people call a bunion a growth, that is a growth on the foot, or it's excess bone that is developing in the foot. And this really isn't the case. It is your bone that has just swung out because of a lack of stability of your midfoot. So let's go into some of the common causes of bunions. Probably one of the most common causes of bunions is overpronation, or what you may associate with flat feet. Now, overpronation can cause bunions because overpronation is typically an unstable foot. When the foot becomes unstable, the joints in the middle of the foot have lost the stability to keep that metatarsal in its alignment. Another common cause of bunions is ligament laxity. Now, ligament laxity is classically associated with a bunion that you may see in a teenager. This is referred to as juvenile hallux valgus. So anytime a teenager or someone who's probably early 20s, I know that they have ligament laxity creating or as the driver to that bunion formation. Now, other causes of it being genetic or associated with footwear, that really isn't the case. What is genetic is your collagen or your connective tissue integrity, hence the ligament laxity. So the genetic or the footwear can contribute or be a driver to the bunion formation, but it's not a direct correlation. So let's go into some of the symptoms. Some of the classic symptoms of a bunion is that you obviously have the bump. So the foot is going to feel tighter in your shoes. This means that you could experience bump pain. Now, there is a bursa that sits on the side of that bump. And that bursa, which is a fluid-filled sac, can get inflamed and irritated, causing a bursitis. So a classic bunion symptom is a bursitis. Now, you also have a deviation of the toe off of the joint, which is causing you to deviate off of your cartilage. As soon as you shift off of your cartilage, you have now set yourself up to degenerative joint disease or arthritic changes of the joint. So joint pain in the great toe is a common symptom of bunions. Some other symptoms could be that you get sesamoid pain, you get callus formation, you might get ingrown toenails, you might get your first toe hitting into your second, and now you start to get second MPJ issues. Let's now go into some of the treatment, some of the conservative treatment. I like to use either a bunion splint. There's a brand called Bunion Booty, which is a soft bunion splint. Or I also like toe spacers, such as Correctives, and these help to create a more centered great toe joint. Now, if ligament laxity or overpronation is also contributing to your bunion formation, you may want to think about using orthotics. You may want to think about strengthening the muscles of your feet, strengthening your core, strengthening your hips so that you slow the progression of the bunion. Now, when a bunion becomes too severe or your pain in the joint is too severe, then this is where you may start to need to think about surgical correction or a surgical intervention. A majority of bunions are structural, which means the only way to correct them is going to be with surgery. Now, I encourage people who are thinking about bunion surgery, do not Google bunion surgery and results, because typically patients get scared. They hear all this misinformation around bunion surgery. Bunion surgery in itself has a very high success rate. I refer a lot of my patients to have surgery when they hit this moderate to severe level, and I'm concerned about protecting the health of the joint. If you don't want to have surgery and you have no pain, you don't have to have surgery. I have many patients who have had bunions, large bunions, for many years, and they're totally fine. You just have to look for wider shoes, use your correct toes or your toe spacers, and keep strengthening your feet and strengthening your hips. If you want to learn more, have a consultation about your bunions, please visit dremilysplichal.com.